Well, in just a few days from now, older cancer patients could be feeling some financial relief. A new price cap of $2,000 is going into effect on January 1st. It would apply to all prescription drugs covered by Medicare. Recipients will also have the option to spread their payments out over the course of a year rather than paying that large lump sum all at once. NBC News health and medical reporter Berkeley Lovelace Jr. joins me now. So, Berkeley, let's talk about how this policy is expected to help older Americans. We know the cancer medications in particular are really pricey. And also, what are the exceptions here?
Right. So this is a pretty big deal for seniors on Medicare. So the price cap applies to all drugs covered under Medicare Part D, which are prescription medications people take at home. Before this change, people typically had to spend $7,000 or more before they reach so-called catastrophic coverage, or when insurance starts covering most of the costs. And even then, patients were on the hook for some of that cost. And so I actually spoke with one patient who spent $56,000 out of pocket in just 5 years on one cancer drug. So she's definitely going to feel some relief from this. Overall, a report found that 3.2 million people on Medicare are expected to see savings next year, and more than 4 million could see savings in 2029. And as I mentioned before, this is especially a big deal for cancer patients who have to take some really expensive drugs. And then, as you noted before, there's one exception. While the caps for the cost of prescription drugs does cap Part B drugs, it does not cap Part B drugs, which are drugs that are given in a healthcare setting. So drugs like chemotherapy will not be covered. So people will still have to pay out of pocket for those, Vicki.
Okay, that's an important distinction. So, Berkeley, we know this price cap part of the Inflation Reduction Act. President-elect Donald Trump has not specifically said whether or not this could come under fire once he takes office. Are we expecting any policy changes, or does this look like a plan that will help these millions of Americans?
Right. So we haven't heard anything from the incoming Trump administration on what they would potentially do. It is possible that they could work with Congress to make changes to this provision. But if I had to make an educated guess, I would say that this provision is probably safe. The policy under the Inflation Reduction Act that I would expect to see a change, though, is the provision allowing Medicare to negotiate drug prices. Republicans have said that they are against that proposal, Vicki.
All right. Berkeley Lovelace Jr., we appreciate it. Thank you very much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app, or follow us on social media.